So we know that 1 out of every 6 people living with HIV in the United States passes through the criminal justice system every year. And we know that there are some important differences between men and women with sort of their lived experiences of HIV and incarceration. And so the goal of this study was to really drill down on those gender differences, looking at HIV treatment outcomes and criminal justice outcomes. So we found a lot of differences actually between men and women in this study. We looked at everyone with HIV who was incarcerated in Connecticut between 2005 and 2012, and we combined a bunch of different types of data from the Connecticut Department of Corrections. We looked at demographics, we looked at custody information, criminal offenses, their laboratory data, pharmacy profiles, so a number of different data points there. And we found that overall, compared to men, the women in the study, there were several hundred of them with up to 600 incarcerations. So the women in the study compared to the men were more likely younger with sort of shorter incarceration periods. They were more often non-Hispanic white and more likely to be medically insured on entry into a facility, either a prison or jail. We found that men and women were sort of equally unlikely to have their HIV well controlled on intake into a facility. The women did really well while incarcerated. They were twice as likely as the men to have their HIV well controlled while they were incarcerated. But as they left the facility, spent some time out in the community, and then were reincarcerated again, they sort of fell apart in terms of their control of their HIV. When we looked at the criminal justice piece, we found that compared to men, women were incarcerated for much shorter periods and most often for non-violent offenses, really public disorder offenses like failure to appear at a court date, violation of probation or parole, or prostitution. So much lower level crimes. So when we looked at predictors of people having their HIV well controlled on intake into a facility, we found that for the women, it was really about just sort of older age. People who were older were more likely to have their HIV well controlled, and people who had other medical or psychiatric conditions that were being treated with medications were more often, had their HIV well controlled too. For the men, however, while those factors did play in, those who had the highest sort of risk of criminal behavior also were least likely to have their HIV well controlled. It means that there are some important gender differences between men and women in terms of the experience of living with HIV and engaging with the criminal justice system. So for women especially, it seems that because they're being incarcerated for really short periods of time for very low-level crimes, that they would be much better served out in the community through alternatives to incarceration that would allow them to have more continuous care in terms of their HIV. So while they do get really good control of their HIV while they're incarcerated, that experience of incarceration in and out of the community is so disruptive to continuity of care. So focusing on programs that not only engage women in care for their mental health and their HIV, but also substance abuse treatment, that would, if for women especially, they would be much better served out in the community. For the men, this finding that those who are most likely to sort of engage in criminal behavior are also those most likely to fall out of HIV care suggests that the same people are sort of disengaging from social systems of support as are disengaging from health-related systems of support. And that suggests a specific target population for intervention. And it suggests that the systems of public health and public safety really need to be aligned.